Every day, millions of people face the same impossible question. Is this serious enough for the emergency room, or can it wait? Without a guide, most people guess. And that guess costs $32 billion every year in avoidable emergency visits. RightCare Navigator was built to answer that question, with AI. 60% of emergency department visits don't need to be there. That's not a patient failure, it's a navigation failure. Patients have no reliable way to translate their symptoms into a decision. They default to the ER because it feels safe. But at 12 times the cost of a physician visit, that default is breaking the healthcare system. RightCare Navigator doesn't diagnose, it navigates. A 2-agent pipeline, powered by Google's MedGemma 1.5, MedSiglip, MedASR, and HEAR, takes a patient's symptoms in any form, text, voice, or image, and routes them to exactly the right level of care, self-care, non-urgent, urgent, or emergency, when the situation truly demands it. Let's see it work. Maria is 34. She's had sharp lower right abdominal pain for 3 days, worsening with movement. She doesn't know if this is appendicitis or muscle strain. She describes her symptoms in plain language. No medical jargon. Duration, location, severity, and what makes it worse. She uploads a photo indicating her pain location. MedSiglip, Google's medical image encoder, fuses this with her text input. 2 modalities. 1 structured analysis. Voice input is also available. For today's demo, text and image. She submits. Watch the pipeline. Agent 1 extracts symptom patterns, identifies body regions, runs HEAR respiratory assessment, and flags red signals. Agent 2 loads clinical guideline context, grounds against MedlinePlus via Google search, determines the care pathway, and generates clinician questions. Emergency care required. The model identified signs of an acute abdomen, specifically peritoneal signs from progressive RLQ pain worsening with movement over 3 days. This is not an overreaction. This is the safety system working exactly as designed. 5 clinician prep questions, including whether this could be appendicitis or ovarian torsion, and whether imaging is needed to rule out a surgical emergency. The clinical reasoning is fully transparent. The model explains why it escalated. That transparency is what makes this safe to use. That emergency recommendation came with a critical guarantee. RightCare Navigator will never name a specific disease, never recommend medication, never invent information, but it will always escalate when signals demand it, always ground its output in authoritative sources, and always prepare patients for a more informed conversation with their doctor. This is AI helping patients reach clinicians, not replacing them. 1 question: where should I go for care? RightCare Navigator answers it. Grounded, safe, available now.